All right, everybody, thank you so much for joining us today. We're so excited you're here. You are in the right place. This is Count the Kicks, evidence-based stillbirth prevention education program that we're going to talk about today. We have a lot of great information to share with you today. If you've ever been to a presentation before, this might be a refresher, but we do have some new pieces that we wanted to be sure to share with you today. This is being recorded. You will get sent an email after this with the recording, a PDF of the slides, and then several links that we'll talk about today during the session. Throughout the presentation, Jasmine and I will probably take our videos off for the majority of it, just because we have videos playing and we don't want to be a distraction, but we will turn them on after at the end so we can answer questions. If you do have questions throughout the presentation, feel free to ask them either in the chat or the Q&A. We'll answer everything at the end, but I want you to go ahead and put them in there just in case so you don't forget them. Maybe we'll answer them as we go throughout the presentation, but this way you don't forget them, and we'll be sure to talk about them at the end of everything. So with that, we're going to go ahead and get started. We're going to take our cameras off here. And first, I have to give out a big shout out and thank you to the Alabama Department of Public Health. It's because of our wonderful relationship with Smil and her team at ADPH that we are here in Alabama. I'm located in Iowa, like I said, and so I'll talk a little bit more about that. But because of this partnership, you get access to all these great free materials, free presentations and trainings, print materials, just a lot of great resources for stillbirth prevention education. And so thank you to Alabama Department of Public Health for helping us save babies in your great state. Today's presenters is myself, of course. My name is Megan Ockett. I am the program director with Healthy Birthday, Inc., which is actually the nonprofit organization that created Count the Kicks. So think of Healthy Birthday as the umbrella, and Count the Kicks is our spoke holding up the umbrella, right? Count the Kicks is our evidence-based stillbirth prevention education campaign, which we're going to talk about today. So I use the terminology Count the Kicks throughout the majority of the presentation. I have been with the organization for about 3.5 years. My background is in public health. I used to work for Iowa Department of Public Health, doing tobacco prevention, education, and control. I'm very passionate about empowerment and prevention and education, and really as it relates to maternal child health. And so that's what really drew me to the organization. I have 3 kids of my own. I use the app with my last, who was born in 2018. And I just love the fact that this is an empowering, patient-centered, patient-focused campaign. And so I'm excited to be here today. I love what I do, and I'm excited to be co-presenting with my friend and colleague, Jasmine. Jasmine, would you like to introduce yourself?
Hi, yes, thank you, Megan. Hi, everybody. My name is Jasmine Hammond, and I am here in Alabama with you guys. I am in the Huntsville-Madison area, so Madison County. I been with Count the Kicks as an ambassador for Alabama for about 2 years now, and it just kind of came out of me being a Count the Kicks app user myself. I used it with my last 2 pregnancies because I had high risk pregnancies, and leaning on this app was really helpful for me just to have that that tool in my back pocket to know, if something was going on, I could kind of show my provider if I needed to. I am a mom. I'm a mom of 4. I am also a birth worker. So being a parent and being a birth worker in the community is really important that we have these tools like Count the Kicks to help keep us educated, especially something like stillbirth prevention. And that's really it about me.
Thanks, Jasmine. So glad you're here today. Jasmine co-presents with me a lot, and I love it. I love the back and forth we have and the relationship. So we have an exciting informational presentation planned for you today. So first, before we dive in, I wanted to share a video, and maybe you've seen this video before, but if not, I share this video for a couple of reasons. We know that the power of storytelling is so important. Anytime you have an opportunity when you're meeting with expectant parents and have the chance to show with them a video like this that's on our YouTube page or any of our other Baby Safe stories, I highly recommend that you do it, because this is what people are going to remember. This is what's going to stay in their mind. It's going to stay in your mind today about why this is so important. I also share it because it does a really good job of showing you how to use the app and the importance of speaking up to your provider. Jasmine and I might reference a couple things that is said during this video, so we share it for a couple different reasons. I can also share that when this aired on Good Morning America in 2017, our app downloads increased around 130%. So we had a huge spike. It just goes to show you that attention, that national attention, that local attention, anytime you can share this with your media. We've had a lot of great media stories lately in Alabama. It's important and it saves lives because people are watching, people are listening, and people get their information from a variety of different sources. So with that, I'm going to go ahead and share with you baby Ruby's story. Let's watch.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So I love that little baby stretch at the end, and we'll talk a little bit more about this, but the fact that her mom noticed where she said her movements just felt weaker, they felt softer, that's really important. So we're going to talk about that here in a little bit, but just a quick overview. So Count the Kicks is an evidence-based stillbirth prevention public health campaign. It serves as an early warning system for expectant parents. We are educating, you are educating birthing people on the importance of tracking fetal movement through the use of our mobile app, which Jasmine's going to share about, or you can use our paper kick counting charts. And it's all about empowerment, right? It's bright, it's colorful, it's empowering expectant parents to speak up to their providers if there's a concern. We know, and I'll talk about this data here in a little bit, but 1 in 3 at-risk babies can potentially be saved with Count the Kicks. That's what we're seeing happen in Iowa, and that's what we want to see happen in your great state. So I just want to kind of level set and make sure that we all know what we're talking about today. And I'm positive you probably do, but just to make sure, just in case, what we're talking about today is obviously stillbirth, which is stillbirth is the loss of a baby after 20 weeks of pregnancy. Miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy. And then infant mortality, which tends to be the one that gets most confused with stillbirth, is death of an infant before his or her first birthday. And what I want to draw your attention to on this slide is the fact that we're losing, on average, 23,500 babies to stillbirth every year in the United States. We're losing just as many babies to stillbirth as we are to infant mortality. yet we rarely talk about it. Why are we not talking about stillbirth just as much as we're talking about infant mortality, just as much as we're talking about the Back to Sleep campaign and SIDS prevention? And that's not to underscore the importance of those conversations for infant mortality prevention, but what I want to do is shine a light on it that we're not, it's still very taboo. And so if we can get to a point where we are talking about it and we are talking about the importance of tracking fetal movement in the third trimester, and we are talking about stillbirth, we have a real opportunity here to decrease that stillbirth rate and those numbers and save more babies, but we have to talk about it. And that's why you're here today, to get comfortable and learn the tools and resources available for you to be able to talk about this information and talk about stillbirth and stillbirth prevention with your patients or clients. So now Jasmine's going to talk a little bit more about the numbers and the data.
So all the information that Megan just gave us are pretty impactful information, right? So when we look at stillbirth by the numbers, we look at the national data, and on your screen here, it's going to give you a really great breakdown exactly on what those numbers look like. Just keep in mind a few important things. So first thing is that 1 in 169 pregnancies end in stillbirth. That's huge. And so as you can see here, there's a breakdown on the racial disparities that persist. But just also keep another note that just as prevalent as infant mortality, stillbirth is just as prevalent as infant mortality, in that families are 10 times more likely to lose a baby to stillbirth than they are to SIDS. So it's really important to know that when we're thinking about infant death, the difference in between stillbirth numbers and then infant death as a whole. So we're gonna look at our Alabama data here. This is gonna hit us a little bit closer to home when we break it down to our state. So the stillbirth rate is 8.85 per 1,000 live births. This is on a 5-year average, as you can see there. And 1 out of 113 pregnancies in Alabama end in stillbirth. That means that we're losing about 527 babies to stillbirth each year. And if you look on the graph here, you see that light blue color, that teal line, that is the national average, right? So our yellow is going to be us, that's Alabama, and the red is Iowa. You see how much more Alabama is above the national state average? That's a huge difference there. So the stillbirth disparities in Alabama, we are able to see the breakdown from 2009 to 2019. So this is a 10-year graph you have in front of you. And again, we're going to be looking at numbers. So the teal is going to show you what's most white expectant parents, and then in the yellow, the goldish color, are Black and other. You see that it is almost tripled in numbers and the disparities with stillbirth rates in Alabama alone. So using this tool, understanding Count the Kicks, how to talk to your patients about this, we can start seeing those numbers come down a lot more.
That's right, Jasmine. This is the Iowa data if we compare it to Alabama. And what I want to draw your attention to is the fact that Count the Kicks launched in Iowa in 2008. From 2008 to 2018, we saw a 32% decrease in the number of stillbirth in the stillbirth rate in Iowa. In the first 5 years of the campaign, we saw about a 39% decrease among the African-American stillbirth rate. And so what we want to do when we talk about that 1 in 3, that 32% rate, that's what we're talking about. We have the potential to saving 1 in 3 at-risk babies from preventable stillbirth. So that dashed line that you see, that's the trend line. That's what we want to see happen in Alabama. And together we can make that happen. We know there's some outliers, like you can see in 2017, things like a syphilis outbreak, a pandemic, things that can exacerbate the stillbirth rate year after year. So that's why it's really important to look at that trend overall, those 3 and 5 year averages, because that's what we're paying attention to, right? So we need to make sure that we see that downward trend in Alabama, just like we've seen in Iowa.
So just like Megan mentioned on the previous slide there is a large divide when it comes to those who are more likely to experience a stillbirth. So I just want to take a moment here to share with you guys the research that has been shown to some contributing factors to this. Now, just keep in mind that Healthy Birth Day, Inc. has reviewed research articles And these points come from various articles, and we will happy to share this with you guys. If you're interested, we can send this over to you in an email, but we're going to review some of the things that shows up here on your screen on this slide. So you may be wondering, why are there such a large disparity for stillbirth? Well, research does show there are a lot of factors to the racial health disparity in stillbirth. And what that is showing us is that it's the systemic racism. I'm sorry, guys, I'm tripping over my words. Toxic stress. And research has shown that the years of being treated unequally and unfairly, essentially being an African American woman in a systemically unjust society, and all that comes along with that, has led to a real health issue for Black women. And epigenetics is a psychological variation that are caused by external or environmental factors that switch genes on and off and affects how cells read the genes instead of being caused by the changes in the DNA sequence. And then we have a few other things that you can read along on the slide here that will explain to you what is causing such of a large disparity for the stillbirth within the racial disparities here. So what is Count the Kicks going to do to help reduce the stillbirths with the racial disparities? So I'm going to read over these bullet points, but while I'm reading these, we're going to also want you to think about not only what Count the Kicks is doing, but what you can do as a provider, what you can do as a community worker when speaking with parents, that it will help you as well with reducing these disparities. So a few things that we can do is work within the marginalized communities, working outside of typical healthcare settings. We have the app that's available in 14 different languages. So this way that no one is excluded. What needs to be said can be provided for everyone in their language, so it's better understanding. There's going to be culturally appropriate educational materials. So that way things look more relatable to the person that you're providing the information to. Is relatable to the information that we're providing to you guys to be able to have out. There is a health equity coordinator and director that is on the Count the Kicks staff. That's going to keep us trained and knowledgeable with disparities, inclusion, and so forth, to make sure that we are relaying the messages across for everyone as well. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. And there we have inclusive organization with 100% board and staff training on anti-oppression and structural racism. Again, this is something, like I was saying, this is things that you can do as well within your community and your practice. And then we're going to be working on improving programming based on lived experiences of women of color. That's by reaching out to the community, reaching out to those women, hearing their stories, understanding their culture, and seeing what we can do to make sure that we are able to have more of an outreach and resources for them. And then have videos and printed educational materials and questions and answers that are available in multiple languages. And again, that just reaches out to people that may have language barriers, so that way you can read it in their first language and be able to understand a lot better and communicate things a lot easier with their provider when needed to.
Thanks, Jasmine. So now that you all know about the data and the research behind it, let's talk about the research and evidence behind Count the Kicks itself. And so, like I've mentioned a couple times, Count the Kicks was founded in Iowa by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. And so, quick story about them and how we came about is they did not know each other at the time of their loss. They got connected through pastors and friends as they started kind of connecting and grieving together and meeting for coffee, they all sat there thinking, this is a lot more common than people think, because here we sit all relatively similar stories, and we were told that this isn't that common. We were told things like, it's like getting struck by lightning, which is not a fact. It's a lot more common than getting struck by lightning. And so here they all sat thinking this. And so long story short, one of the first things they did was create the first stillbirth registry in the United States. So a way to track stillbirths in Iowa and the trends to kind of see what's happening in the state and what can be done about it. So it was because of this stillbirth registry that they went to a public health conference and presented on it. But while they were at this conference, they also heard about a research study that had been done in Norway that showed when expectant parents were educated on the importance of tracking fetal movement in the third trimester, that among this cohort of expectant parents in the study, that the stillbirth rate decreased nearly 30%. And so hearing this, the founders thinking, wow, 30%, like that's amazing. Like kit counting's been around for a long time, but the tools and resources to educate and talk about stillbirth and stillbirth prevention with parents and for providers to talk about it hasn't been created. So let's come back to Iowa and create it. We have one goal. Let's create this empowering campaign and save one baby. That was their goal in 2007, 2006. And so they came back to Iowa with this research that you see on your screen here. It's also on our website under evidence. They came back with this. They came back and they searched for other evidence and research on the importance of fetal movement monitoring. They worked with Iowa Department of Public Health and created Count the Kicks, the stillbirth prevention education campaign that you know about and what we're talking about today. And so if you're not into reading journals and things like that, I understand, but I highly recommend you at least read this one. Like I said, it's on our website. It's not very long, but it's super impactful, right? This is the one that started it all. So Dr. Ruth Fretz, she was one of the researchers on this Norway study, and she's also now part of our medical advisory board. And she was the only US researcher on this study. And her quote here kind of says it all, that encompasses our entire campaign. She says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. I cannot emphasize this enough, and Jasmine will emphasize it too, and we'll talk about it. It is so important that you walk away today knowing that what we're talking about is understanding their normal movement pattern. And we'll go into that in a little bit, but I want to draw attention to that one. I also want to share that probably one of my top questions that I get when I do presentations or I go to conferences or I get calls and I get told, I don't want to do this because I'm going to have all of these parents, all of these pregnant individuals say that they're anxious now because I told them to do this. And I'm here to tell you that doesn't happen. I think as human beings, we tend to go to like what could possibly be the worst case scenario. I think there's actually a saying of that. I've heard before, but I promise you that does not happen, because what you're doing is actually reducing anxiety, because now you have an educated individual that understands what's normal for their baby and how and when to speak up. They have data in their hands. So this research study here says one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. So we have also done our own study of our thousands of app users and through the Des Moines University and the Harkin Institute, and found that 84% of app users stated that regular tracking was associated with feelings of bonding. They could sit down, they're focused on baby, they're including significant others, they're including siblings, they're focused on baby. And 77% of app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And then I think there's added benefits that we don't always think about. Things like, because I think there's this misconception that somebody's going to come in with a change in fetal movement and there's going to be an automatic C-section. But that's not the case, right? Because this is a way to check on baby. It's not a way to automatically do C-section. There's other tools and resources that providers will do to check on baby. 9 times out of 10, somebody comes in with a change in fetal movement and everything is fine. They go through an NST and get things checked out. But we want to make sure we catch that one time, right? That one time something's off, either with mom or with baby. And so things like reduction of preterm birth rate have happened. Fetal growth restrictions are identified earlier, because remember, a change in baby's movements is sometimes the only warning sign that something is going on. But what's even more surprising is that women who have stillbirth are substantially higher risk for severe maternal morbidity than women who have had live births, regardless of the cause of fetal death. So there is an intrinsic connection between stillbirth and maternal mortality, which is a very hot topic right now, right? And as it should be, we should be talking about maternal mortality, and we should be coming up with real solutions. And this can help with this. So due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. When I talk about that connection, right, we released in April a white paper between the connection of stillbirth and maternal mortality and morbidity, firsthand accounts of American women. And so these are just some of the bullets of the white paper. You can go to our website, you can scan that QR code. I will also send a link to it in the post-webinar email, so don't feel like you need to scan this or write it down right now. But here's just some of the stats from it, right? In the US, the rate of maternal morbidity and stillbirth is higher than other well-resourced developed countries. Research shows that the risk of severe maternal morbidity is more than 4 times higher among stillbirth deliveries compared to live births. And according to one study, more than 15% of maternal deaths within days of delivery occur in women who experience stillbirth. So there's a real connection that we need to address, right? And here's a tool that helps bridge the gap between patient and provider. And now Jasmine is going to talk about the meat of it, right? Like how we implement this, how the app works. So Jasmine, take it away.
Absolutely. Yes. So what we're going to do is we're going to talk about why movement matters, right? That's really important. We need to know why it matters and why we're telling our patients what we need to be doing. So movement is one very important way that a baby communicates before birth. A change in a baby's movement can be an early sign, and sometimes it can be the only warning sign that a baby may give when the baby is in distress. So there are 3 different types of movement changes. A baby will have fewer or no movements at all as they start to slow down. The baby may move, but movements may be softer or weaker. And then a baby's movement may be a sudden wild surge, right? So this could be something that's like a jolt that's not normal. And this can be an important sign of distress. And this can be known as the cord could be in a tight knot. So these 3 types of movement changes is really important when discussing what kind of movements that we're looking for and the ones that really matter.
Yeah. And I'll just add, Jasmine, with that third one, what research and what we've talked to when we've talked to lost moms and things like that have said that it was almost like a violent surge of movement. So very like almost frantic, they would explain and say. And so what's really important is just understanding what's normal for your baby. So if that wasn't normal, then they need to speak up to their provider and see what's going on.
Right. Yes. So when we're going to start kicking or start counting kicks, right? That's really important to know when. And we're going to start doing this about 28 weeks gestation. If you have a patient that is high risk or expecting multiples, you want to start discussing with them around 26 weeks. And this is when research has shown that baby has established more of a consistent pattern that the expectant parent can feel in track. So it's really important that we let them know that this time frame is important because that consistent pattern is what we're looking for. So what is going to be considered a kick? Well, this is going to be a roll, a kick, a jab, anything except for a hiccup, which is like an involuntary movement. We want to make sure that we're getting those, those cute little rolls, those kicks, those elbows that might be going over there in the ribs. Those will be something that we'll be looking for kicks.
You can tell Jasmine has a 9-month-old at home, so this is very recent to her. She remembers those kicks, right,
Yeah.
Jasmine?
Yes, I remember all those kicks.
Yeah.
So how to count the kicks is going to be in tune with your baby and with your body. So we want to make sure that we are reminding parents to start their kick counting around the 3rd trimester, which is going to be either 28 weeks or 26 if we're high risk or carrying multiples. And it's super easy. 5 steps here to stay on track to give you that extra bonding time, right? So at the chart here in front of us, mainly we just want to make sure that we are using the free Count the Kicks app. You can download that. If your parent doesn't have access to a mobile device or computer or anything like that, there are paper charting that can be downloaded and printed out for them as well. They can continue to keep up with their fetal movements. So once we get the app or our paper, we want to make sure that we're tracking every day and preferably around the same time every day. Again, that goes back to us saying that consistency, right? So if we can do this every day around the same time, we kind of get a pattern going. And what we're wanting to see is how long it's going to take for your baby to get to the 10 movements. Everybody's going to be different. My baby may have wanted to sleep more so in the morning, whereas your patient's baby may be ready to go at 10, in the morning. So whatever is going to be normal for that baby to get to that 10 movements. So once we get a good pattern, 10 movements, after a few days, the app is going to say, hey, okay, we got us a pattern going. And then we're going to see what it's going to look like on an average amount of time it's going to take to get to those 10 movements. So we've established a routine. We know we need to get to the 10 movements, and then we're going to kind of see how that's going to start working on a day-to-day basis. And we want to continue to do so. And you're to encourage your parents that once they see this good routine going, this pattern going, if something looks off, rather it be more frequent movements out of normal or less movements out of normal, then that way they have this tool to bring to you, and you just let them know that, hey, I know that you're using this app. I know that you're using your paperwork. So when they bring this to you, that you have that listening ear and know that they know that something is wrong. Sorry. So this is right here is the details on the app. Again, like I said in the previous slide, it is free. We always love free apps. It does come in 14 different languages. That's pretty awesome. So this kind of, has it really easy for everyone to be able to understand and can translate this back. It is available on both Apple and Android products. And then also you can use the app and you can restart the session, or you can delete a kick if you made a mistake and tapped it one too many times, or if you got sidetracked and wasn't able to get a consistent time frame, you can always restart it, which is really neat that you can do that. It has a daily reminder, which is used probably a lot. I had to use the reminder. As you have a busy day going on, sometimes you just got to have a reminder set for everything, right? You can review the count history. So if you are the provider, and let's say I'm your patient, and I come to you with my app, and you can say to me, hey, Jasmine, let's look over your history. You got a concern today? Well, let's see what's been going on in the past. That's going to be really great for you too, to be able to have that patient provider report there. You can download the history, they'll be able to download the history and then share it with you for you to be able to review. They can share it with their family. So that way everything is kind of inclusive. Everybody's on board. You can count the kicks with twins. That's awesome. So that way you can have baby A, baby B, and we're making sure that everybody is being monitored. You can track future pregnancies using the same profile. Like I said, I was a 2-time user, so I just logged right back into my same credentials, and I was able to start over with my last baby with doing so. So that way you don't have to have all these different accounts and things like that. And then it is available on your Apple smartwatch, which is super cool. If you're an app junkie like me, if you just, really quick to tap on your watch, I think that's really neat. Just remember, if you're telling your parents this, it's only available on the Apple smartwatch. So
yeah,
that's really neat there. Yeah.
That's great. I love how you said you're an app junkie. I think I am too. So
Yes.
that's great. That's great. A couple quick tidbits here too. If you all work with a demographic and you need the app or materials in a certain language that you do not see on the screen here, feel free to let us know, because there's a lot of opportunities for us to either write grants or work with the state health department that they also want to make sure that they're meeting the needs of you all and all of your clients. So let us know if you need something else, and we can work with our contacts and figure out what we need to do. I can tell you that the app will soon be coming out in Portuguese and Hebrew. Those will be our next languages that we'll be releasing here soon. We also have a web-based kick counter that will be coming out here within the next month or so. So that would be a great tool for, if somebody doesn't always have access to Wi-Fi and they can go to their library and count during the day, or a friend's house, or at work, they can't pull out their phones, but they can use the web. You can use them all together. So you could count one day on the web, the next day on your phone, the third day on your watch, and it all syncs together. So those are some cool features that are coming out that I wanted to make sure you were aware of, because we probably won't do a presentation for Alabama here in the next couple months, but be sure to get on our newsletter so you have access to all that, so you know when things go live and everything like that, because that's where we'll announce it.
That's a really great feature. And another great feature that the app is going to also have is the strength tracking and notes feature. So this has been added because research shows that expectant parents should also be paying attention to the strength of the baby's movements while counting and tracking their kicks. So with the new strength and tracking feature, at the end of each kick counting session, you'll be asked to rate the strength of the baby's movements. If your baby's movement becomes weaker, it can be a sign that your baby needs to be evaluated. So this feature is going to teach us how to judge the strength of the baby's movement. And then you can also rate your session from fluttery to fierce. So fluttery will be a little light movement that are hard to see from the outside, similar to what parents probably were feeling when baby first started to move, right? And then we have a fierce. We know what fierce is. We have those fierce movements that would be strong, and they're probably going to be able to be visibly seen with the baby moving around the inside. And it could feel like a limb is going to like poke out of your belly. You know, sometimes you feel the baby poking through your belly button. That's going to be a fierce movement. So when you're explaining that to parents, just kind of make sure that they know the difference between how to rate that, the fluttery and the fierce. And it can simply rate the strength of the kick counting session by selecting fluttery, which is indicated by 1 footprint. And then it goes up to fierce, which is the 5 footprints. And you'll see on your screen there, those cute little footprints, what that will look like for them. And then they could add the notes. So the notes will be detailing how the session went and what they may have noticed during the kick counting session. So the note could say the baby felt strong like normal. They could put in there that they were moving around a little bit more, or whatever the notes that may have been going on. Maybe it was a noisy environment, something like that. Just to notate what was going on during that particular session to kind of help correlate the strength of that movement. So once you finalize your session, they will be able to see a graph, and the graph is going to show the strength average as well as the time that it took for the baby to get to those 10 kicks. If you notice that there is a significant increase in the average time where baby is taking a little bit longer to get to those 10 movements, or if there is a decrease in the strength of the baby's movement, then we need to encourage parents to contact your providers, your provider, as soon as possible. Any reduction in fetal movement can be a sign that something is wrong, such as low amniotic fluid or a ruptured amniotic sac to an entangled umbilical cord. So it can be, any of those things that could be going on. And then we will also want to encourage the patients that if for whatever reason your office is closed or their provider office is closed, let them know the hospitals are always open. They're there 24/7 and they're ready to serve. So if they cannot get in contact with you guys, let them know not to wait. They can just go ahead and go into their nearest hospital to get seen and show them that app that they've been using. The risk of not speaking up will outweigh the risk of going in.
Right, exactly. Oops.
So, I'm sorry, guys. So here we have something that we're excited to announce is that the latest update to the app. We have found that when we recently launched the app, that the resources that can be found on the menu now are able to get onto the website as well. You can do this by going to healthybirthday.findhelp.com. So what they're going to see on the website here is going to allow the users to enter their zip code in, and then they can search for free and reduced cost services that they may need. So they may be looking for Section 8 housing, local doulas in the area, food banks in the area, any kind of free local resources. They'll be able to get on the website and have it listed there for them. It is always going to be updated. So just, if you haven't spoken with them in a few appointments, just say, hey, don't forget, they can look on the website just in case there is something that they may have missed. Of course, if there is a service on here that you as a provider may think that should be added, feel free to let us know, and we'll try our best to get that on there. And making sure that, we have resources available for everybody that's within the community.
Right. Yep. And you can access this on the resources side of the app, as well as this website that Jasmine said. So it's a great way to connect people prenatally to free or reduced cost services that they may need. So the chance of that baby experiencing adverse childhood experiences could decrease dramatically. So this is a newer tool, a newer feature. And like Jasmine said, you can go in, make sure that it's up to date, that if you have a resource or organization that you know about that should be on here, feel free to let me know, and we can get that added.
Yep. So we're going to watch a little short video here together, so you can see how easy it is just to use those apps. The video will demonstrate those 5 steps that we talked about. And as you'll be able to see, is that it's going to take out all of the guesswork and remembering how long it takes. And it's going to empower our expectant parents to speak up if there is a change. So let's watch.
Maybe. There you go.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So she says 12 languages because we shot that video and then we added 2 more languages after that, but it is 14 languages. So I just wanted to clarify that. So now that you know about the app and you know that we're talking about understanding what's normal for their baby and to speak up, let's talk about how you talk about stillbirth with expectant parents that you serve. So thinking about maybe some of your concerns right now or things that you've heard is that, you don't want to scare expectant parents, right? This is a touchy subject. This is hard to talk about. It's dark. We understand that. But I think what we also need to understand, and you all know, is that pregnancy is full of risks that we talk to expectant parents about. We talk about the importance of taking prenatal vitamins, not drinking, not smoking, all the blood tests that we do. And stillbirth is another risk that expectant parents deserve to be educated about. Or maybe you've heard or thinking about that stillbirth just happens. There's nothing we can do, or stillbirth doesn't happen anymore, right? That was something from my great-grandparents' age, but it is happening, and it's happening more frequently than you think. And there can be warning signs, but we need to know what to look for. And a change in baby's movements is one of those main things that we need to know what to look for. Or your baby's always active. It's not a concern. I bring this up a couple different times throughout the presentation because I guarantee you will get this from your expectant parents that you serve. You'll talk about this and they'll say, oh, awesome. I don't need to do that though, because my baby's always active. It's like a jungle gym in there. I know you're going to get this because I thought the same thing. I have had friends that have said this to me when I talk to them about this. And what I say to them is the same thing, and what you can say to your parents and say, that's awesome. A healthy baby is an active baby, but it's still really important to understand and know if your normally active baby has slowed down, because cord and placental accidents can be sudden. And so tracking your baby's movements daily takes the guesswork out of knowing if your normally active baby has slowed down or significantly changed their movement. Or what about they're almost at her due date? Any of those old wives' tales, especially if you work with you know, people living in multi-generational households, or I had my grandmother who was always telling me that I was about to pop and I was still like 3 months to go. That's always nice. Or baby's running out of room. But the risk of stillbirth actually increases as an expectant parent approaches or exceeds her due date, and it increases significantly. So what about talking to expectant parents who have had a stillbirth previously about fetal movement? Follow the same protocol. The only big difference that you're going to have is that you're going to start talking about this at 26 weeks versus 28 weeks with your expectant parents, because they're considered high risk at that point. And if you are their provider and you're on the call today, make sure you read their chart prior to entering the patient room, especially if you're a new provider for them. Or if you're meeting them for the first time and they tell you about their previous loss, ask them questions. It's okay to ask the name and the gender, staying away from medical terms like fetal demise, being empathetic, asking them, has anybody ever talked to them about the importance of tracking fetal movement before? A lot of expectant parents that we've talked to, lost moms, have said, you know, I had 2 or 3 previously live births and nobody, not one, has told me, nobody has talked to me about the importance of doing this. I did notice a change in fetal movement, but I didn't know I should have spoken up. I didn't know. Why didn't I know? Why didn't somebody tell me? So we want to turn that why didn't I know to I'm so glad I know. I'm so glad I saw a poster in the restroom when I was giving my urine sample. I'm so glad I saw it at my public library. I'm so glad I listened to a baby shower and they talked about this. You have a real opportunity. You are the grassroots in Alabama to make this difference and be able to turn that why didn't I know to I'm so glad I knew. So now Jasmine and I are going to kind of go a little role playing, but we're going to talk about some of the common myths that you might hear as you're working with expectant parents. So Jasmine will read the myth and then I'll read the actual fact.
Okay. So my baby is always active, so I don't need to count kicks, right?
Great question, Jasmine. Again, a healthy baby's an active baby, and we're so excited that your baby's active and that you're paying attention, but it's still really important to track your baby's movement every day so you don't have to think about it and it takes the guesswork out of knowing. So set your reminders on your app to make sure that you're tracking daily, and Count the Kicks. The app will give you real data to show me, your healthcare provider, if you have a concern.
Well, only those who are experiencing a high-risk pregnancy should pay attention to their baby's movements, I thought.
That's another great question, Jasmine, but I'm here to tell you that I want all expectant women to be educated on Count the Kicks, to get to know what's normal for their baby. We don't just talk about the glucose test or have people that are maybe higher risk for gestational diabetes take that test. We do that with everybody, and this is no different. Everybody should be talking about Count the Kicks and fetal movement monitoring, and everybody should be doing it daily.
Well, my baby should get to 10 kicks in 2 hours.
10 and 2, right? A popular one. I've even heard 10 and 1 before, but I'm here to tell you that every baby is different, and the recommendation to expect 10 kicks in 2 hours is actually outdated. Current research indicates moms should work to understand the normal amount of time each day it takes baby to get to 10 movements. And what I want to add here is the fact that there's research on this. There's research on our evidence page, but basically what it says is, as humans, we focus on the time, right? Like, you know, you have about 12 minutes left. Like, we have a lot to get through in 12 minutes, but we'll do it, I promise. But that's what you're focused on, right? And so when we hear that 10 and 2, when we hear that 2 hours or that 1 hour, that's what we hold on to. So let's say I'm counting, and I've been counting for 3 weeks, and my baby gets 10 movements in 15 minutes, and it's been routine. It's been pretty average. It's been about 15, 20 minutes for the last 3 weeks. And one day I'm counting and I get 10 movements in 1 hour and 47 minutes. But I think to myself, that's okay, because my provider told me I should get 10 kicks in 2 hours, or I read that, or I heard that. But that's not my baby's normal, right? My baby's normal has been around 15 or 20 minutes, not 1 hour and 47 minutes. Whether or not I got it in 2 hours or not, the fact is that's not my baby's normal. So that's why it's so important that we're paying attention to what's normal for our baby. My baby might take 10, 15 minutes. Jasmine's baby might take 20, 30 minutes. I've had 3 pregnancies, and my first son was 5 minutes or less. My daughter, where I didn't have the app because it came out in 2015 when she was born, she took 30 to 35 minutes. I went to triage 3 different times with her fetal movement because I didn't understand that that was her normal of when I was tracking. I was comparing her to my son who didn't take long at all. Everything checked out fine. She turned 7 yesterday, like wonderful, but I didn't understand that that was her normal. So that's why that's so important.
I can just use a Doppler device to monitor my baby's well-being.
Right. I know there's apps out there you can get, but I really, really don't want you to use a Doppler device unless you're medically trained because a change in the baby's heartbeat is one of the last things to change. Whereas when baby's in trouble, whereas a decrease in fetal movement or a change in fetal movement is one of the first things to change.
If baby isn't moving, I should drink cold water or eat something sugary to get baby moving.
So that used to be what we would tell people, right? But research has moved away from the idea that sugary drinks and the like are a good way to get baby to move because kick counts are best monitored without interventions like juice and candy. Because if baby's not moving like normal, parents should speak up to their provider right away. And think of it like this. When you and I are sick, we are not going out and running a marathon. We are sitting on the couch. We are conserving our energy. We're trying to drink lots of fluids. We're resting, we're sleeping. Same with baby in utero. If something's going on with baby, whether it's low amniotic fluid, a cord issue, a maternal issue, something is causing them to change their movements. Why are we trying to force baby to move if it's not their normal movement? So we want to go away from interventions and just understand what's normal for our baby.
Babies kick less near the end of pregnancy.
So they don't necessarily run out of room. Obviously, they get bigger, but so do you. The types of movements may change, more jabs, fewer rolls. So you might have less of those huge, like body rolls where you're like, oh my gosh, that baby totally switched sides, and more of those like pokes, the pokes in the rib, like Jasmine was talking about. But again, babies should move up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time each day, it should still take about the same amount of time to feel those 10 movements, regardless of where they're at in their gestation.
Triage doesn't need any count the kicks education.
So I just told you how I went to triage with my daughter, right? 3 different times. That is the perfect opportunity because I got checked out. Everything was fine. How wonderful would it have been had they sent me home with a brochure or a gold standard discharge paper? So if anybody's listening today that works with triage, works with labor and delivery nurses, go to them and say, hey, have you heard of this? Remember, you're the boots on the ground. You're the reason why this is going to be successful. And we're going to decrease the stillbirth rate in Alabama.
Pregnant people should avoid dental care.
So we have a really cool initiative going on right now with the Oral Health Bureau in Alabama. I'll talk about in a minute. But we want you to know, and you probably do know this, but so share with your patients and your expectant parents that you still want them to go to the dentist even when they're pregnant. There's a lot of things going on with pregnant bodies, and oral health and good oral health is still really, really important. I've been learning all sorts of things about the connection between good, healthy pregnancies and healthy oral health. So let's make sure that we're encouraging them to go. And then really quickly, other ways to integrate this, again, think through your own system. Like, are you doing family care plans? Are you doing intake documentation? Are you a clinic where you can have them do that wonderful sugary drink and then they sit there for an hour waiting for their blood test and they could read the brochure and download the app? Could you add things like this, a discharge paper, an after visit summary, like I could have had with my daughter, where it clearly states in my discharge notes how to count the kicks? Email me. I'd be happy to talk to you about what works in your workflow so you don't have to think about this, that this comes easy and that you're doing it every single time you see and work with expectant parents. So now Jasmine's going to talk about some of our additional resources. And Jasmine, I don't think we're going to have time to play the music as much as I'd like to.
Okay, no worries. All right, guys. So finally, now what? What are we going to do? Well, now that you have a full background on Count the Kicks and how to talk about it with your patients and your clients, let's order some material. Thank you to the partnership with the Alabama Department of Public Health. You are able to order these materials online for free. So if you will, take your phones out, get on computers, and go to www.counttthekicks.org and click on order materials and fill your cart. And then boom, everything gets sent to you. And again, these materials are free, so don't be shy. Order as much as you need. So we're not gonna have time to play the music, but I want you to take the time to go ahead and do so for while we're finishing up the slides here. And then if you need some encouragement, I want to just make sure to say, hey, you will be entered in a drawing to win a $25 gift card to Amazon. So everybody go ahead and start ordering your material so you can
Yeah.
try to win that gift card.
Yeah. And I know we can all multitask, right? So go to counttthekicks.org, order the materials. What's really cool, like she said, is we have picture-based materials now and magnets as well. Like that's all new thanks to this partnership with Alabama Department of Public Health. So go ahead, Jasmine. Sorry, I interrupted again.
No, it's okay. No, that's really cool. The magnets are really cool. I just saw them, so
Yeah.
they're really neat. And that's a if anybody's going in the fridge all the time, hey, there's your reminder, right?
Exactly.
So another great tool that Count the Kick is offering is a free training. You can earn, some credits there if you need any. This is going to help our healthcare professionals have that conversation about fetal movement, right? So if you need to understand how to implement this in your practice with using the Count the Kids campaign, this training is going to be able to do that and more. It's all evidence-based and it's non-invasive. So these are the good tools that, that we want to be able to provide to help prevent stillbirth.
Yep. And don't worry about writing down this website. Again, I'll send this out in an email so you can just click on it.
And then we have a few more resources here, like using the Parent and Provider Academy, the printable kit counting charts that's going to be available in both English and Spanish. There are plenty of videos that explains everything, how to use the app, how to kit count, and so forth. So these are really great free resources that you can use for yourself to have an understanding, and then as well as direct your patients there if they need a little bit more as well.
What about you, Jasmine?
Another another great resource is the ambassadors like myself. We are women that's across the nation that are working super hard to share the Count the Kicks education and the message throughout the state. So of course I'm here representing the state of Alabama. We are volunteer ambassadors and we help with a variety of things, like how I'm on this presentation with you guys here today. I've done a news interview. I can set up for a baby shower. I don't mind coming to the office and helping you order the materials if you need me to. If you have a question, whatever the case may be, I am right here in the state with you. Megan is a super awesome tool. She has all the information. So if we have any questions, if it's something I don't know, I can always piggyback on her. But just having someone personal, right here in Alabama that understands the Alabamian ways, I'm here for you.
Yeah. Jasmine is great. And she will be in the news article that I'm going to send. She was interviewed from a Baby Safe story that she's going to share here in a minute. And so coming soon, just wrapping up before we get to our wonderful, wonderful Baby Saves is, I've mentioned it a couple times throughout, but we also have this awesome partnership with Alabama Public Health, but also the Oral Health Office, the Bureau there, where you will be able to, if you work with dental clinics or you have access to hygienists, and you can reach out, because remember, you can share this information far and wide. You can go to libraries, you can go to walk-in clinics and drop this material off. You can go to dentists. We will have posters available that talk about the importance of how good oral health care and kit counting go hand in hand. And we will have magnets that you can pop out and like it's a frame so people can put their appointment reminder card in it. So look for more information. We're really excited about the launch of this. We just announced it on the Alabama Department of Public Health website. So I'll be sure to share that with you all in the post webinar too. So that is coming soon.
Awesome. And look at those babies there that parents are able to snuggle just from having a resource tool from like Count the Kicks. Awesome. So I'm going to briefly go over baby Aspen's story here. This is a baby save from Alabama that we learned about a few months ago. And so her mom was letting us know that as a first-time expected mom, I was happy to learn about the free Count the Kicks app from the Count the Kicks educational materials that was shared at my doctor's office. My OB was insistent that I count kicks every day in the third trimester to help me track my daughter's health. I created my kick counting routine based on when I noticed that my daughter was most active. The app was so easy to use and did help me learn my baby's kicking habits. So I wanted to make sure that you guys just took that in for a moment, that her OB was insistent that she use this app daily. And it's really important that you're letting your patients know to use the app every time that you see them and letting them feel encouraged to come back and let you know when there's an issue that has come up.
Yeah, and I'll share her story and, like I said, her news article, her interview with her mom. So we're so excited to see that happen. And we know there's more out there. We know you guys are doing this and sharing this. These save stories come to us when the parents themselves just contact us and say, hey, I was using your app. I noticed, change in fetal movement, and now my baby's here because of it. I was using your app because of my provider, or my home visitor showed me it, and things like that. So finally wrapping up, and we're right at the top of the hour. So we'll stay on for questions, but next steps, become familiar with the app, which you've already done because you already downloaded it. You're going to order materials, which you also already did because you also want to be entered into a gift card. This takes 3 to 5 minutes. This does not take a long time to talk about. And I want you to make sure that you're talking about it every single time you interact with expectant parents. Make sure your entire staff knows about this. Think through ways you can integrate this into your workflow. And then remember, hours and minutes matter in preventing stillbirth. So especially if you live in a very rural area and somebody has a 60-minute drive to the nearest birthing center, but they think they might want to wait until their family care clinic opens the next day. Like, encourage them to go to their nearest birthing center if they need to. Like Jasmine said earlier, hospitals are open 24/7, and that's what they're there for, to serve you, to make sure that your baby and yourself, your body is okay, and that everything's okay. So connect with us, sign up for our newsletter, follow us on social media, reshare things. Happy to answer any questions. I know we went 1 minute over. Thank you so much for all that you do. Yes, Kathy, that is a great resource. I'll talk to Samil about how we can make sure that the Alabama PQC, then the interactive map that you talked about, it gets incorporated into the app for anybody in Alabama. Happy to answer questions and stay on. Feel free to raise your hand and we can unmute you. Use the chat, the Q&A. Jasmine, Kathy did ask you a question of where did you hear about Count the Kicks?
Hey, Kathy. So I heard about Count the Kicks just from being pregnant myself, and I have a history of gestational diabetes. And so my provider was like, just make sure that you're kick counting. And again, like I said, I'm an app junkie. So I got on my app, I got on my app store, and I was like, okay, I got to figure out something to keep up with this, because I don't have paper and pen around all the time. And I just typed it in my search thing on my app store, and Count the Kicks popped up. And what caught me was the vibrant colors. And I was like, oh, this is really cool, And I started using it and playing with it. I was like, this is awesome. And so I remember using it throughout my entire pregnancy, and it just made me feel, confident in knowing that I had this tool to use, especially since I knew that kick counting was important for me. And so then once I began my journey as becoming a birth worker, I, wanted to make sure that I was letting as many parents know about this as well, the importance of stillbirth prevention, things that we can just have in the access in the palm of our hand. And so I reached out to Count the Kicks about their ambassador program, and here I am. Trying to make sure I spread the word about saving Alabama babies.
Yeah, we love it. We love Jasmine. Any other questions? If not, you're free to go about your afternoon. Like I said, this has been recorded. I'll send everything out within the next day or so. And just thank you. Thank you for all that you do in your great state. Maybe I'll come visit in November. There's some things coming up. So you never know. You might see me in person with Jasmine. Thank you, everybody.
Hopefully we don't have any snow.
I hope not. I hope not. I don't need to come to Alabama to see snow. I got